SDTM visit versus ADaM.AVISIT. Introduction. Now the SDTM.VISIT and ADaM.AVISIT variables, they both refer to the study visits in clinical trials, but they differ in purposes and they are constructed differently due to the distinct goals in the SDTM and ADaM data models. So let's go through with certain examples and with the real world scenario examples. Okay, SDTM.VISIT variable. Now the purpose of this variable is to describe the planned or the actual visit name during the study as per the protocol. So say in protocol we have certain assessments, right? So in those assessment, whatever is the planned date or whatever is your planned visit, that planned and the actual visit is the purpose for the SDTM.VISIT variable. Domain, it is found in SDTM domains like AE, VS, LB, EX. This is adverse event, vital signs, laboratory and exposure. It is not limited to only these domains. It is also found out in most of the other domains which are there in the SDTM models. Source, derived from these clinical source data or the CRF case report from. So usually this SDTM.VISIT variable, the data, it is derived from the clinical source data that is collected in the case report form. So whatever that data is collected in the case report form, that is entered in the database, and that database is nothing but your SDTM visit variable, which is your raw. The type is usually textual, for example, week 4, visit 3, and the end of treatment. Here in this particular variable, you will find the screening visit as well, right? So we'll go through its example, SDTM.VISIT variable example. So here you will see unique subject ID which represents 101, 101, 101. Now this particular patient has 3 records of visit number 1, 2, 3. One visit number is a numeric identifier which is used for the sorting purpose, and it represents the screening visit. 2 represents the baseline visit and 3 represents the week 4. Right. So what was the day 1 of screening? So that day 1 is usually minus 14. The reason is we are calculating the back days, the very first day when the treatment was started or when it was the non treatment kind of that first day, that is the baseline value, right? So post baseline and pre-baseline. So before consuming a specific treatment, right, or before consuming that specific medicine, that is my baseline, and after whatever we consume that particular treatment, those all visits are post baseline. So in those scenarios, this baseline represents 1. And when the screening was started, now remember one thing, whenever that particular patient is screened in the specific clinical trial study, it follows normally 10 days to 15 days or 20 days to reach to the baseline value. Baseline is nothing but that particular visit from where the treatment was given, but the dose will start in the next visit, right? So that is, this screening is the visit, that is minus 14. So that's how it is calculated, because we are calculating this as the first day of the visit, that is my baseline. Now after this, at week 4 is my 29 days. So how many days were there between this date or this date? So I'll have visit is baseline and visit is week 4. So I will have respective start date and end date of that specific visit. So when you do the subtraction from week 4 to baseline, you will get, say, normally 29 days. So that represents the study day of the visit. ADaM.AVISIT variable. Now the purpose of this variable, it represents the analysis visit names used consistently across all ADaM datasets for grouping and summarizing data. So this is the analyzed visit names, and it is found in most of the domains which are related to ADaM datasets, that is ADSL, ADLB, ADVS, ADAE. So this represents subject level ADaM dataset. This is laboratory. This is vital signs and this is adverse events. It is not limited only to these specific domains. It is presented in most of the domains. The analysis visit, A visit, wherever it is applicable and wherever it is used for doing the analysis for the tables and figures. So in those scenarios you will find, so typically it's a standardized analysis ready visit label derived from the SDTM.VISIT variable. Now this specific variable A visit is dependent on SDTM.VISIT variable, right? Now this specific SDTM.VISIT variable, its data comes from the source, that is CRF, nothing but the raw data which is present in the database. So from raw data it comes to SDTM, and from SDTM we make some calculations and we do some analysis visit. We adjust the visit windowing and we do all those kind of structured kind of procedures that we follow. In that particular scenario we get the analysis visit. Now why it is termed as analysis visit? Because this is usually used for the sorting and the merging purposes whenever we are using any analysis basic part for the tables and listings, right? So I have certain analysis, like say for example visit 1 and visit 2 I want to combine to some other visit or giving some other label. So I will try to club those two visits and try to see whether what analysis variable. So it's an analysis ready kind of visit names that are given, right? Now let us go through the ADaM.AVISIT way example. Now this is the same unique subject ID 1001. Now the param code is systolic BP, blood pressure. The A visit is my baseline, week 4 and week 12. Now the A visit one is 1, 2, 3. So in this is the same baseline at which particular the treatment is given, but the in the next dose your measurement is taken, right? So those all correspond to these specific visits. Now A visit is often derived and aligned to protocol defined time points. Missing or unscheduled visits may be excluded or aligned to nearest scheduled visit. So now what happens is, this specific variable, if there are any missing or unscheduled visits, if a protocol is saying that we will exclude unscheduled visits or we will delete all those records and we are not going to do analysis for that table listings and figures, so those can be removed in the ADaM datasets. But if your protocol says and if your statistical analysis plan says that the missing visits and the unscheduled visits will be analyzed, then in those particular scenario these unscheduled visits you will have to align to nearest scheduled visit, okay, and then you have to club to that specific visit. Now it may so happen that in a visit column you will have two duplicate records in the sense the same subject ID with same param code and with the same visit but two different values. In those scenarios you need to confirm with the sponsor what needs to be done in those kind of data, so that they will give you that whether we need to pick up the best possible value or the first visit that comes into the picture. You will have the date and time as well, so you can sort according to the visit date and visit time. So in that scenario you can pick up whichever is the nearest scheduled visit and whichever it falls in that. So those kind of scenarios you will see whenever you work on the ADaM.AVISIT. Now why these are required? Now these are required mainly due to so many reasons. The first reason is regulatory requirement. So SDTM.VISIT variable, yes, it is a regulatory requirement and it is raw structured as collected. So whatever data that is collected, it is maintained in SDTM.VISIT variable. Again, the ADaM.AVISIT is a requirement regulatory and it's an analysis ready structure, meaning whatever the visit windowing or the unscheduled visits, we will align it to the nearest visit. That happens in a visit, but this does not happen in visit variable. This comes directly from the raw data set. You need to understand the difference between these two. Now the SDTM.visit variable is used for organizing data. Again, the ADaM.AVISIT is also used for the organizing data. Now a SDTM.visit variable is a time point based analysis. It's not the standardized enough, right? So this is whatever the data that is collected in CRF and that is present in the raw data set, the same is presented in the SDTM.visit variable. Now understand, here I am talking about only two different variables, visit and a visit from SDTM and ADaM. So here the an ADaM.AVISIT, you will see time point analysis. So it's a very clean and consistent. You will always see some, like, you will see some PK parameters or some, which has a time point based analysis, or when you will see the survival analysis. So in those kind of things, you will see the time point base. So it is very clean and consistent. Now this specific variable SDTM.visit, it is used in TLFs but not directly, right? So this particular variable is used in listings for presenting or doing the patient profile listings, right, from the SDTM. But ADaM.AVISIT, it is used in tables and figures, right? So whenever you present the table listings in this way, like say the tables and figures are generated from ADaM and the listings are generated from SDTM. So what happens whenever anybody does the cross checking or reviewing of the data, that specific particular reviewer will come to know whether it has been calculated properly in the tables and figures, right? There may be some listings which will not be possible to present from SDTM but from the ADaM. So those listings are also presented in ADaM, whichever is the sponsor's requirement. Now this SDTM.visit variable, it is used for merging with caution but may not be consistent. So this can be used for merging, but it is not consistent. And usually a visit variable is always used in merging, and it is consistently labeled, right? And it is used for sorting, because this a visit is an analysis ready structure. So it becomes very easy to label it properly, and it becomes very easy for analysis and for presenting the data. Now what are the key differences? Summary. Now these are the features. For the purpose is captures raw visit name. Like I said, it takes from the raw data set and from the CRF. And the purpose of a visit is to standardize for analysis. So this specific variable is dependent on visit. We will do some manipulation, we will do some adjustments in programming, so that this specific variable is a standardized format, and that is used for the table listings and figures. Now this specific variable visit is collected in CRF. Like I said, it's just collected from the raw data set, whereas a visit is derived from the SDTM. So this variable is dependent on this. Format is usually textual, and this is a standardized, meaning it is a standardized structure not across only one domain. It is standardized across all domains. Like say I have this ADLB, ADVS, ADAE. So wherever there is the a visit kind of variable in all the domains in one specific study, the same standardized format needs to be used. Only then you will be able to generalize that specific table listings and figures. So this specific SDTM.visit variable is not used in analysis. Like I said, it may be used for patient profile listings just to check the database, whereas ADaM.AVISIT variable is used for analysis. That's why it is made as analysis ready structure. Now this specific variable SDTM.visit, it is not always aligned across subjects. So you will see some visits are not correctly, like mapping, and it's not properly, and it's not aligned well across between subjects. But what happens in when it comes to a visit, the visit labeling, the visit numbering, the visit sorting, and whatever all those terminologies that are being used, it needs to be maintained consistency, so that it aligns across all subjects. So that feature, it is present in ADaM.AVISIT. So this is what is the differences between SDTM.visit and ADaM.AVISIT variable. Now example use case. Now suppose a subject has multiple unscheduled visits. So in SDTM, you will see them listed as unscheduled, possibly multiple times. So it so happens, like say for example, I am doing any blood cancer related study. So what happens is the blood is not coming. So maybe multiple times the blood is collected. The timing was at 9 o'clock, but the it wasn't suitable, or the patient was not ready, or that specific time was missed. So it was taken at 9:10. Then at 9:10 there were not sufficient blood was collected, so it happened on 9:15, then 9:20. So maybe 2 to 3 times the specific blood was collected. So those kind of whatever information that you see, it usually happens in SDTM. So that thing you will present in SDTM. Whereas in ADaM, these may be excluded, imputed, or assigned to the nearest scheduled day visit for meaningful analysis. So like I said, for example, say there were 3 possible unscheduled visits, the blood was collected, and it was recorded. But when we do the analysis, it's not like all the 3 we will be considering. Those 3, whichever is the latest or whichever is the possible or a meaningful value, or the which is present in the ranges, or in the lower and the upper limit, whatever that range is there in between, so that will be assigned to the nearest scheduled a visit for meaningful. Now ADaM is anyways used for meaningful analysis. So in those scenarios, whenever you will see 2 to 3 multiple records in SDTM, wherever there is unscheduled, whatever is your imputed, meaning you will if it is missing, then you will place it with the best possible value, or it is assigned to whatever sorting, that whichever is the last or whichever is the first value, or whichever is the best value specific, or it can be completely included in the analysis, or it may be completely excluded in the analysis. Now, what is the tip? Now, think of it SDTM visit as what happened in the study. So, whatever that happens in the study, that is my raw data, and that is my SDTM.visit variable. And ADaM.AVISIT is nothing but how you want to analyze the study data. So, I have a bunch of visits, but how it is needs to be analyzed based on that study data, that I need to define it in a visit, whereas visit is my actual raw data, whatever that has happened in this study. Please like, share and subscribe. Leave a feedback comment mentioning any topic that you want me to make a video. Looking forward for a positive response. Thanks for watching. Please like, share and subscribe. Leave a feedback comment. Many thanks for your support and having great connection.